Welcome. I'm Nicole Turgeon, Director of the Kidney Pancreas Transplant Program. Thank you for choosing Dell Seton Abdominal Transplant Center to be your transplant provider. I'm really glad you're here. By choosing to be evaluated, you are one step closer to transplant. So now let's talk about what to expect during your transplant evaluation. During your transplant evaluation, you'll see multiple providers from our transplant team. You'll meet with our transplant nephrologist, transplant surgeon, transplant coordinator, a social worker, a pharmacist, our dietitian, and a financial counselor. This video is designed to ensure that you understand what your kidney transplant evaluation will entail.
Hi, I'm Jana, transplant coordinator. Your transplant coordinator will be your point of contact during your transplant evaluation journey. I will review the informed consent process with you and coordinate your workup as a potential transplant candidate. I will make sure you stay informed throughout the entire process and help answer any questions you may have. We will provide you with some pre-transplant education material for you to review. On the day of your transplant evaluation, please make sure to arrive on time. Your transplant evaluation appointment marks the beginning of your transplant journey, which may require multiple appointments, testing, and your active participation. Next, you'll hear from the providers who will see you in clinic.
As a part of your surgical evaluation for transplant, we will determine if it is safe for you to undergo transplant. We will also explain the risks of transplant surgery and your anticipated recovery. We will discuss the different ways you can get a kidney, including living donation through either direct donation or paired exchange, and deceased donation, as well as some programs to shorten your waiting time for a kidney. We will discuss what you will feel like after the transplant surgery and when you can return to your daily activities.
Hi, my name is Dr. Brian Lee, Medical Director of the Kidney Pancreas Transplant Program. A kidney transplant offers the best treatment for those with kidney failure, both in terms of longevity and quality of life. During your medical evaluation, we will discuss the medical risk and benefits to transplant. We will discuss your medical history and how that may influence your candidacy for transplant. We will also discuss some of your medications that may present as a challenge to transplant. Additionally, we will review your dialysis records to determine if you are adequately tolerating your treatments, as that may impact your transplant outcomes. We will also review with you any heart or cancer history that may make transplant difficult. We also assess your physical condition to determine how the risk of surgery and post-transplant medications may impact you. Finally, as a part of your medical evaluation, you will be required to undergo blood testing, X-ray studies, and heart testing. We will also review your records and testing results to determine your transplant candidacy.
I'm Gloria, the transplant social worker. As a part of your transplant evaluation, we'll discuss your psychosocial strengths and needs in order to make sure you're at a place where you can be most successful after transplant. Your transplant social worker will ask you questions about what your goals are for transplant. How do you feel about getting a transplant? What is motivating you to get a transplant? And what do you see yourself doing after your surgery? They will also assess your adherence with your current treatment regimen. Do you go to all of your dialysis treatments? And do you stay for the entire time? How well do you adhere to your diet and fluid restrictions? How do you manage taking your medications and going to appointments? Do you have any difficulty following doctor's recommendations? You and your transplant social worker will also talk about your family background and current life circumstances to determine your caregiver support plan. Who would you consider as part of your support network? What is your current living situation? A kidney transplant is a major surgery to recover from, and you are required to have at least one caregiver who can help take care of you at home after your surgery and drive you to appointments. Please bring your caregiver with you to your transplant evaluation so that they can also meet with our team and learn more about transplant and what their caregiving responsibilities will be after transplant. How far away do you live from Dell Seton Medical Center? If you live more than 4 hours away from our hospital, you and your caregiver will need to plan to stay here locally in the area until you're more stable to return home. Your transplant social worker will also ask about your work responsibilities. How much time off do you have available to take for your transplant surgery? If you haven't been working for a while, what are your plans for returning to work after transplant? Your transplant social worker will also review your financial resources with you. Do you have adequate resources to manage your post-transplant medications? What is your plan while you're off from work? Additionally, your transplant social worker will assess your history and current tobacco, alcohol, and substance use to ensure that you meet criteria for transplant and provide resources for assistance if appropriate. And finally, your transplant social worker will perform a mental health evaluation to determine if you have any risk factors that would need to be further addressed before transplant, so that you can be mentally and emotionally prepared for transplant. Your transplant social worker is here to ensure that you are psychosocially prepared for transplant, so that you can be successful and meet your goals after transplant. We look forward to meeting with you.
I'm Meredith, the transplant dietitian. Many can often overlook the key role that nutrition can play in the transplant process. Proper nutrition can provide patients with an opportunity to enhance their physical health, minimize poor symptoms they may be having, and properly manage their underlying disease conditions to ensure proper recovery following their surgery. During my visit with patients, I provide a comprehensive nutrition assessment and physical assessment to gain a better understanding of their current dietary patterns, functional status, and current knowledge of the proper diet they should be following. When considering transplant surgery, it is very important that the patient is strong enough to recover successfully. Light physical activity, and for some, even physical therapy, can assist each individual in helping build and maintain adequate strength leading up to their surgery. Additionally, a patient may be advised to lose or gain weight in efforts to help them get to a better physical spot for transplant. Our transplant team's goal is always to ensure that this surgery helps improve their quality of life and that the risks never outweigh the benefits. In all of my visits, I make sure to provide patients with education and counseling to help address any concerns we may identify during the visit and help them reach their personal goals. A renal diet often can be confusing and appear to even contradict other nutrition education they may have received in the past. Certain nutrient needs may vary between individuals, especially considering that each patient may have different concerns and goals. With this said, my goal is for the patient to always leave our time together feeling confident and equipped to take ownership over their health and ultimately get one step closer to transplant.
I'm Rachel, the transplant pharmacist. After transplant surgery, you will need to take medications to maintain the function of your transplant. Transplant recipients must manage a complex medication regimen, which includes immunosuppressant medications that are taken for life. It will be more important than ever before that you take your medications on a regular schedule and do not miss doses. My role on the transplant team is to help you be successful in creating and maintaining a schedule for taking your medications, as well as helping to manage side effects and answer any medication questions that you may have. During my visit, I will ask about prescription medications you currently take, as well as any over-the-counter medications, vitamins, or supplements that you are taking. I will ask about your history of any allergies or side effects with medications. Bringing a list of your current medications to the evaluation appointment helps to make sure that we review all medications that you take. We will discuss how you currently take your medications and any difficulties you may have with obtaining, paying for, or taking medications. This information helps me to provide tools to help you be successful with taking medications after transplant. We may also discuss changes you can make prior to transplant to help you become more consistent in taking your medications and optimizing your current health. During the visit, I will also share some general information about what to expect with transplant medications. Our transplant team's goal is to help you to live as many years as possible with a functioning transplant. Taking medications consistently and as prescribed is one of the best ways to ensure that a transplanted organ lasts for many years after surgery.
Hello, I'm Jessica, the Transplant Financial Coordinator. As part of your transplant evaluation, we will review your insurance benefits and ensure you have a full comprehension of your patient responsibility when it comes to evaluation, surgery, post-transplant, and medications. During this time, I will provide education on common insurance vocabulary such as deductibles, out-of-pockets, co-insurance, and co-pays. We will also review your income and expenses during this process. I will ask about your monthly income, employment status, monthly expenses, household size, and financial support. The reason we discuss and review your finances is to minimize any financial burden and ensure your success post-transplant. To wrap the evaluation up, we will discuss other resources that may be available to you during the evaluation process, as well as post-transplant. This can include resources such as American Kidney Fund, supplement plans, and Medicaid, to name a few. I will also be providing information on eligibility, enrollment, and coverage for these products. The goal of this financial evaluation is to ensure your financial soundness post-transplant and minimize any financial burden that this process may bring.
Thank you for watching this video. Remember, we are here to support you during your transplant evaluation process. Please contact your transplant coordinator with any questions you may have. Once again, we thank you for trusting the Dell Seton transplant team with your transplant care.